Welcome back. Well, you may hear this from time to time. Calm down. You're going to make my blood pressure spike. Just chill, right? Well, sometimes it can be something of a joke, especially for people like Archie Bunker. Remember this line from the classic sitcom, All in the Family? Watch this.
Only one thing concerns me. Your blood pressure is 170 over 98.
Oh, gee.
Well, that's just a little high. Let me ask you, Mr. Bunker, are you the excitable type? Do you get upset easily?
No, I don't do that. No, ask her.
Well, only when something upsets him.
What kind of an answer is that?
You do get upset, Archie, we gotta tell
I
him.
get upset when them young guys down at work start razzing me about my age, that's all. Now, Junior here asked me a question. I don't need the help of talking dingbat to give him an answer. Stifle yourself.
So, what do you think? But seriously, looking at this, high blood pressure is not really a laughing matter at all, especially now as it's in the headlines. Almost half of all Americans, 46%, are now considered to be in the high blood pressure category, based on new guidelines released earlier this week. Now, some Americans who once thought that their blood pressure was normal and considered in well-controlled levels, quote unquote, will now be diagnosed with stage 1 hypertension. So what does all of this mean? And here now to talk this through is Dr. Ali Kazrine. He joins us now to talk about these new guidelines. Okay, so let's first talk about high blood pressure, right? What that means, and you get those numbers, and what those numbers mean actually about our health.
Yeah, so everyone looks at your blood pressure, and it's got a top number and a bottom number. So basically, what it is checking, and now everyone, goes in. You go to Walmart, or you go to Walgreens, or CVS, or any kind of
gas station
everywhere, and you kind of put your arm and you sit there, and the blood pressure cuff increases, and it's called a sphygmomanometer. And basically, you have a blood pressure. Actually, the best way to get it, if there's a discrepancy, is to actually have a person do that. So if we have a discrepancy, we actually have our nurses or ourselves check it, and I have a stethoscope and listen. What you're looking for is what happens to the pressure in your blood vessels when the heart is contracting, and what happens when it's relaxing. So that top number is called the systolic blood pressure. Is what is the pressure in your blood vessels when the heart beats and contracts. So that's the top number. So it's like 120 over something. And that bottom number, the diastolic blood pressure, is what is the pressure in your vessels when the heart relaxes.
Okay, now let's talk about the old guidelines, where they were, versus the new guidelines, and why now people who once thought they were totally in the clear now are finding out that they could be diagnosed with hypertension.
So they brought the guidelines down, where now the old target was 140 over 90. And now the new target is 130 over 80. And this all came in response to a study that was published in the New England Journal of Medicine in 2015 called the SPRINT trial. And this was a very beautifully done study that compared and randomly assigned people over 50, the age of 50, to 2 treatment groups. They wanted their blood pressure to either be less than 140 or less than 120. And they found that the people who had the lower blood pressure, less than 120, had a 25% reduction in cardiovascular events. They had less heart attacks, they had less strokes, they had less heart failure, and most importantly, they had less cardiovascular deaths. So that's significant, that's profound.
Yes, and you found a really interesting way where you can go to the American Heart Association. There is a calculator there where you can put in all your information, and it will let you know what your risk factors are as far as
so one thing they look at this thing where it's important is you can go to a risk calculator and see are you at risk. So one big important thing to see when you need treatment is if you have a risk of having a cardiovascular event in the next 10 years, heart attack or stroke, that's above 10%. So if that's the case, you need to potentially consider being on therapy. So the first line for decreasing your blood pressure, because now, like you said, a third more of people, 46% of Americans now are diagnosed with having blood pressure problems and having hypertension, where before they didn't. So if you look at the numbers, now 50% of adult men, 38% of adult women, that's where it was a third before, now have high blood pressure. So these are a significant amount of our population are not diagnosed with blood pressure. So do we put everyone on medications? No. But if you're in that higher than 10% risk of in the next 10 years, you may have a cardiovascular event that may kill you, maybe you should be on a medication. And this risk calculator is great. We were playing around with it before the show started. It looks at your age. It looks at your risk factors, your cholesterol level. Do you have other medical issues like diabetes? Do you already have high blood pressure? Are you on aspirin? Are you on a statin? Takes all these things into consideration and sees what is your personal risk. And, you know, if you're concerned about this, go talk to your doctor.
Right, right. Better to be safe than sorry, which is why, in your opinion, would you say making these guidelines a little bit more stricter, if you will, a good thing?
I think it's a great thing because awareness is great and being mindful is great. What you do with it is also very important. So this is going to be strict for some people, but I think where it impacts the most people is going to be young and middle-aged adults because before they didn't think they had high blood pressure or blood pressure issues. And this also, to be mindful, doesn't mean that you go get a blood pressure the first time you have a giant coffee and you run into the doctor's office and have a high blood pressure, or you have, you know, what we call white coat syndrome is the issue. You have to have multiple blood pressure. They recommend getting 2 blood pressures checked at separate times, at separate occasions, and getting the average of those. So you have to have a consistent
on one day,
on separate occasions.
So it's separate days. So
Yeah.
if I go Monday at noon and then Tuesday at 6, and just
It's to make sure that you have an average of a consistently elevated blood pressure. Sometimes they put monitors on. They consistently evaluate to make sure that you're consistently showing a consistently elevated blood pressure. And this isn't to make your life miserable, it's to extend your life and lower your risk. This is an assessment of risk. So you want to lower your risk of things that could potentially impact your life.
because we joked at the top with Archie Bunker,
Sure.
right? But those kind
Absolutely.
of things can spike your blood pressure, you know,
Absolutely.
co-hosts, those, you know, what, I'm just kidding.
I mean, yeah, you have a co-host that should actually calm you with a cheerful disposition.
A little zen. We got to go, we're out of time, but what can we do? Just some takeaway thoughts from you as far as to keep our blood pressure in check.
So that one thing, relax. You know, make sure you decrease stress. Stop smoking. If there's one thing that you can do, you can stop smoking. Exercise, healthy diets high in fruits and grains and vegetables. Decrease salt in your diet. Prepackaged foods. We eat out a lot. Be mindful of those things. Those can have impact. Maintain a healthy weight. All those things can actually. They found that actually decreasing a kilogram of weight can actually, that's 2.2 pounds, can decrease your blood pressure by 1 point with each loss. Talk to your doctor.
Yeah.
Talk
The bottom
to your
line,
doctor.
information is key.
Pay attention
Every
to
little
this.
thing makes a difference.
It could have impact.
Good deal.
And if you have diabetes, high blood pressure, cholesterol issues, talk to your doctor to make sure those things are maintained and well controlled, because it can save your life.
Good deal. And I want to give you the website very quickly. Not only your website, which is KesarineUrology.com. There's also the American Heart Association website where that has that risk factor calculation. You can go there. It's just very simply American Heart Association. Google that with calculator. You can do that on your own to see if you have any increased risk factors. You can also, by the way, listen to Ali Kesarian, Dr. Kesarian. He is on the radio show called The Conversation, weekends every Saturday on 690 WOKV. You can call him and ask him whatever you want. Good to see you, Doc. Thanks for being here.